I bet you know someone, or maybe even you yourself, have experienced some form of back pain. Back pain is the third leading cause for people to visit with their medical providers. And it's estimated that 80% of the population will experience back pain at some point in their lives. Back pain affects people from adolescents to elderly. Most cases of back pain are what are considered mechanical, meaning it isn't related to a serious problem like cancer, infection, or fracture. However, back pain can be very frightening. You were fine yesterday and today you woke up and you can hardly move. It can be very worrisome. You may be worried about, how am I going to get to work? How am I going to take care of the things I need to do? This worry and fear can play a role in your recovery. It's important that you visit with a healthcare provider and you determine a very excellent self-care plan for yourself. My name is Irene Silvernell. I'm a licensed acupuncturist and a registered nurse. And I want to talk to you today about the recommended guidelines for acute and chronic back pain, some self-care tips, and some recommendation number 7, we'll talk a little bit about acupuncture. All right. So, the American College of Physicians and the American Pain Society got together and they reviewed a lot of current evidence to come up with the 7 recommendations that they provide to medical providers. Medical providers utilize practice guidelines to assist them in making good choices along with your input so that they can come up with a good treatment plan for you. This is known as evidence-based medicine. Let's go over those guidelines 1 to 7, okay? The first recommendation is that your physician should conduct a thorough history and physical. Clinicians should not routinely obtain imaging or other diagnostic images in patients with nonspecific low back pain. So this is why you need to ask, what category was I in? Because you may wonder why you're being sent away with maybe no further testing. So this helps you lower your worry level so that you kind of know what they were thinking and how they came up with that diagnosis. Clinicians should evaluate patients with persistent low back pain and signs and symptoms of radiculopathy. So remember, radiculopathy is that pinched nerve, so those signs would include weakness, pain, numbness, tingling, sharp radiating pains, maybe loss of some kind of muscle movement. This would be considered signs of radiculopathy. At this point, your physician will recommend to you an MRI or maybe a CT scan. Your physician should provide you some evidence-based information on low back pain with regards to when should you expect to feel better, what are some things that you can do for self-care. So let's go over some self-care tips. For example, what the research shows. Back pain is mechanical in the majority of people, as we've already said. So the first thing is, once you feel well enough, start moving. It's very important to stay active. Gentle stretching, gentle yoga, short walks, and avoid sitting for long periods of time. Number 2, decrease the amount of sugar that you consume while you're in this inflammatory state. Sugar has been shown to increase inflammation in your body. Number 3, for the first 6 to 8 hours of the pain, go ahead and use ice, but after that, use heat. Number 4, reduce stress and anxiety. Try implementing a meditation program. Stress and anxiety will all contribute to your lack of healing. Number 5, get plenty of rest. Remember, rest and sleep is when your body is in a regenerative, recuperative state. The clinician should consider medications with proven benefits in conjunction with the potential risks. So have a conversation with your physician about the medication that they might want to order for you. It's important to ask them, what's the long-term efficacy? What are the risks of this medication? What's the plan for getting off the medication? How long do I need to use the medication? The guidelines also include some herbal recommendations, which included willow bark, cat's claw, cayenne, I would also recommend turmeric, but I would say to you, if you want to use herbal medications, it's very important to consult with an herbalist or an acupuncturist. They will help guide you with the proper type, form, dosage, anything you need to worry about, side effects, looking at interactions with your other medications. So I wouldn't recommend just buying some herbs without consulting with somebody with some knowledge. Finally, for patients who don't improve with self-care, the things that we just went over, clinicians should consider recommending some non-pharmacological therapies, and these have some proven benefits and a lot of research to support them. For acute low back pain, a non-pharmacological therapy includes spinal manipulation, better known as chiropractic care. For chronic and subacute low back pain, some of the recommendations include intensive interdisciplinary rehab programs, and this includes physical therapy, vocational therapy, behavioral therapy, exercise programs. This could include strengthening, flexibility, and endurance. Acupuncture. Acupuncture is a technique that stimulates specific points in your body by inserting needles. It is usually a component of what we consider traditional Chinese medicine. The research has shown from a number of very large studies that acupuncture helps to ease chronic pain with backs, knees, and necks. So there's a lot of evidence out there. Some of the other ones included massage, yoga, and progressive relaxation. At this point, you might be wondering, well, what's the best one for me? How do I decide? Well, here are some guidelines that might help you. What resonates most with you? What have you always wanted to implement but maybe never did? For example, maybe you always wanted to implement yoga into your exercise routine but never have, and here's a great opportunity for you. Or maybe you tried chiropractic or acupuncture and it resolved whatever your problem was, but you haven't considered returning, so maybe you know somebody. Or maybe you have a friend who's raving about their massage therapist, right? And she had low back pain. Whatever you decide, it's very important that you make sure they're qualified in their field of expertise, that they have experience dealing with people who have your kind of back pain, and meet with them and evaluate them and see how you feel and how you feel about the treatment plan that they develop with you. If you have questions, please feel free to contact me, either with a message below, or you can review the resources that I have posted in the links below. Best of luck in your journey of healing. Thank you.